Well, thank you and good morning, everyone. Today I'd like to talk about the growing number of people who've become economically inactive since the pandemic and the moral mission of reforming welfare to give everyone who can the best possible chance of returning to work. Now, the values of our welfare state are timeless. They're part of our national character of who we are as a country. We're proud to ensure a safety net that is generous for those who genuinely need it and fair to the taxpayers who fund it. We know that there are some with the most severe conditions who will never be able to work, and some who can no longer work because of injury or illness. And they and their loved ones must always have the peace of mind that comes from knowing they will always be supported. But we also have a long-standing and proudly British view that work is a source of dignity, purpose, of hope. The role of the welfare state should never be merely to provide financial support, as important as that will always be, but to help people overcome whatever barriers they might face to living an independent, fulfilling life. Everyone with the potential should be supported, and not just to earn, but to contribute and belong. And we must never tolerate barriers that hold people back from making their contribution and from sharing in that sense of self-worth that comes from feeling part of being something bigger than ourselves. And that is why this is a moral mission, and why the value of work is so central to my vision for welfare reform. And it is fitting to be setting out that vision here at the Centre for Social Justice. Because if you believe, as I do, that work gives you the chance not just to earn, but to contribute, to belong, to overcome feelings of loneliness and social isolation, and if you believe, as I do, the growing body of evidence that good work can actually improve mental and physical health, then it becomes clear we need to be more ambitious about helping people back to work, and more honest about the risk of over-medicalising the everyday challenges and worries of life. And the whole system is undermined by the way people are asked to make subjective and unverifiable claims about their capability. So, in the coming days, we will publish a consultation on how we move away from that to a more objective and rigorous approach that focuses support on those with the greatest needs and extra costs. We will do that by being more precise about the type and severity of mental health conditions that should be eligible for PIP. We'll consider linking that assessment more closely to a person's actual condition and requiring greater medical evidence to substantiate a claim, all of which will make the system fairer and harder to exploit. And we'll also consider whether some people with mental health conditions should get PIP in the same way through cash transfers, or whether they'd actually be better supported to lead happier, healthier and more independent lives through access to treatment, like talking therapies or respite care. I want to be completely clear about what I'm saying here. This is not about making the welfare system less generous to people who face very real extra costs from mental health conditions. For those with the greatest needs, we actually want to make it easier to access with fewer requirements. And beyond the welfare system, we're delivering the largest expansion in mental health services in a generation, with almost £5 billion of extra funding over the past 5 years, and a near doubling of mental health training places. But our overall approach is about saying that people with less severe mental health conditions should be expected to engage in the world of work. And fifth, we can't allow fraudsters to exploit the natural compassion and generosity of the British people. We don't just need to change the sick note, we need to change the sick note culture so that the default becomes what work you can do, not what you can't. Building on the pilots that we've already started, we're going to design a new system where people have easy and rapid access to specialised work and health support to help them back to work from the very first FitNote conversation. And part of the problem is that it may not be reasonable to ask GPs, who are perfectly very busy at the moment, assess whether their own patients are fit for work. It too often puts them in an impossible situation where they know that refusal to sign somebody off will harm that precious relationship with their patient.